Still on health, let's take you to the north. Kidney cases in the northern region. Records from the Tamale Teaching Hospital show an upsurge in kidney-related diseases in the region in the past 3 years. The kidney cases include children, a good number of whom die at the hospital because the center has no machines and consumables for treating renal diseases in children.
With the increasing burden worldwide, particularly in Ghana, chronic kidney disease and acute kidney injury may require renal replacement therapy at some stages of the disease. Dialysis services still remain a mirage to many victims of chronic kidney disease in Ghana due to cost and paucity of hemodialysis machines. Chronic kidney disease is a major public health challenge with a global prevalence of 15 to 74 cases in millions of children. Preventing chronic kidney disease in children, slowing its progress and management of complications are essential, especially in challenged health systems in low-income countries like Ghana. Dialysis is used when the kidneys stop working. Kidney failure, also known as end-stage renal disease, may be temporal or permanent and is diagnosed when there is permanent loss of 90% of total kidney function. Some of the reported causes of kidney disease in children include birth defects, hereditary diseases, infection, nephrotic syndrome, trauma, and urine blockade. Kidney diseases can also affect children's lives in many ways, causing problems that affect behavior, relationships, and self-esteem. Children with chronic kidney disease may have difficulty concentrating and learning and may develop language and motor skills more slowly than their peers. Kidney cases are on the increase in the northern region. A review by the Tamale Teaching Hospital uncovered an upsurge of kidney-related diseases for the past 3 years. The hospital recorded 61 cases of kidney-related disease in 2021 as against 98 cases in 2022. 10% of such cases recorded in 2021 and 2022 were pediatric cases or children with kidney disease. A number of such children do not survive because adult dialysis machines are used in treating them. Feruza Al-Hassan is a 15-year-old girl battling with chronic kidney failure. She has been put on dialysis for the past 2 years. She says the pain involved in the procedure is heartbreaking.
It is painful, very painful. And when they are performing the procedure, I mostly pant for breath. And it's like I'm dying.
Feruza is committed to a lifetime of renal replacement therapy, and as many of the cardiovascular effects of dialysis are cumulative, she needs 3 dialysis sessions in a week. Feruza's uncle, Zakaria Suleimana, says his niece's condition has drained the family of all their financial resources, and so sometimes she has to skip some of the sessions.
People to help us, because now we don't have money again for coming for dialysis. So now we are begging people to come to help us, or to be coming to our dialysis every time.
Dr. Edwin Die is the medical officer in the dialysis unit of the Tamale Teaching Hospital.
For children, during this, sometimes the tubes and the pass through, that's not the right tube for children.
In ideal situations, we are supposed to have, a pediatric dialysis unit, or like machines for only pediatrics and then machines for adults. But here's not the case in this part of the world where we find ourselves. We don't have a pediatric machine for dialyzing pediatric patients. So what we're doing is that we are using the machines for adults for the pediatrics as well. Now what happens is that as well, and these sieves and filters, usually we have sizes, and you know that the machine picks an amount of blood at a time. So the best is, and the ideal is for us to get a dialysis machine for pediatrics where the filter sizes will be appropriate size filters for pediatrics as well.
Dr. Die said using adult hemodialysis machine on children has its own complications and consequences, and emphasized the urgent need for hemodialysis machines, including pediatric hemodialysis machines and consumables for the units.
The size of the catheters as well. It can also even rupture the vessel. Okay. Yes, please. And also it can also cause what we call disequilibrium syndrome. So as in, you would see that because the amount of blood that is taken is a lot, so what it means is that those electrolytes and other the components of that makes the patient hemodynamically stable will not be there. So what it means that you can see the patient will be on the machine and start having a seizure. The patient can start vomiting, start having tremors and rigors and what have you. Those are some of the challenges that our pediatric patients face by we using these adult size or adult machines for the hemodialysis.
Renal failure, especially acute kidney infection, is common amongst children, but access to pediatric dialysis machines is a far cry, and mortality rate keeps rising. Sustainable Development Goal 3 cannot be achieved without considering investment in child health care. Healthcare must be a priority and adequate funding secured if a country is to make a long-term impact. From Tamale, Joyce Kantam Kolamon, GBC News.